Wisdom tooth or third molar. What kind of problems does a wisdom tooth or a third molar can give? This is Dr. Arun from Pearls Dentistry, running a dental center since the year 2001 in Chennai, Rajanamalipuram. If you have not subscribed to our videos, please subscribe to our channel. We have got 300 videos coming out in the next 1 year. So typically wisdom tooth comes between 17 to 25 years of age. So when it erupts, if there is enough space in our jawbone, the tooth erupts unevenly. There is usually no problem that arises. But for more than 80% of the people, there is always some problems associated with wisdom tooth eruption. So what are the commonest problems that it can happen? So the wisdom tooth is the last tooth to erupt into our mouth. So if there is not enough space in our jaws to accommodate the last tooth, it gets stuck inside. So when I say it gets stuck inside, there can be two kinds of problem. One, the problem because of the bone, because there is not enough space in the bone for the tooth to come out fully. Second, there can be problem in the gum. It means that there is space in the bone to accommodate the tooth, but the position of the gum in that last area is in such a way that the gum covers the wisdom tooth and it starts irritating. So these are the two things. There can be issues in the bone or issues in the gum. So another issue can happen when there is an issue in the bone. There is a lot of pressure when the tooth tries to erupt out into the oral cavity. Because of the pressure, not only there is pain in the last wisdom tooth area, but the entire jaw, ear and neck can hurt when the tooth tries to erupt into the oral cavity. The second commonest thing that can happen is when I say pressure in the gums. When in the gums there is something called the pericoronal flap. When I say a pericoronal flap, there is a gum tissue that surrounds the tooth. That is what it simply means, that that tissue can get inflamed, can get swollen because of lack of hygiene there, because of trying to erupt out. There is not enough, the brush doesn't reach the last third molar area. It's not kept clean and it can start getting inflamed or swollen. So that can also hurt us. The third common thing that can happen is, sometimes there is space for the upper wisdom tooth to erupt, but there is not space for the lower wisdom tooth to come out fully. So then what happens is the upper wisdom tooth erupts more than its normal level and start impinging on the lower gums and then start irritating the lower gums there, causing an inflammation, a food impaction there and starting an inflammation. So these are the commonest problems that can happen. One, because of the bone, and because of the gum tissue there, and third, because of the upper tooth impinging on the lower gum tissue. These are the commonest problem. So the solution, of course, if it's going to be if the tooth has got the potential to come out fully in the mouth, which is 80% of the time it doesn't come out, then probably we can try to clean that area, remove the impinging gum tissue so that the tooth erupts normally. But many times it will necessitate only a wisdom tooth removal or a tooth removal. The complications of which, what are the problems of wisdom tooth removal, we'll be seeing in our upcoming videos. Of course, and temporary solutions can be keeping that area clean, ensuring that the upper tooth doesn't impinge on the lower gums by slight polish of the upper tooth, doing some warm water salt rinsing, using a local antiseptic and anti-inflammatory there to keep the inflammation down, will help to gain you some time so that you can actually seek dentist attention before you can get the wisdom tooth removed. Hope I have answered this question. If there is any other questions, please do ask us. We'll be happy to answer. This is Dr. Arun from Pearls Dentistry, Rajanamalipuram, Chennai. Bye-bye.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.